This is the phase 1/2 study that is going to follow by phase 3 study because of these results. So what we did in this study, first of all, we evaluated the combination of Belantamab mafodotin with Lenalidomide and Dexamethasone in newly diagnosed patients, but we used it in patients with intermediate fit and frail. We had two parts of the study. In the first part, we had randomized the patients to receive either 1.4, 1.9, and 2.5 milligram per kilogram given every 8 weeks, and in combination with the standard dose of Lenalidomide 25 milligram and Dexamethasone. We checked that the dose in order to go to the second part of the study was the 1.9 milligram per kilogram given every 8 weeks. So we introduced for the first time the administration of Belantamab from the beginning every 8 weeks. In these 36 patients of the first part of the study, everybody responded, and outside of some deaths that these patients had because of the infections like COVID-19 especially, and I think 2 pneumonia that we had, during the 3-year follow-up, only 1 patient progressed. In the second part of the study, 30 more patients received the 1.9 milligram per kilogram every 8 weeks of Belantamab with Lenalidomide and Dexamethasone, and we had a randomization according to ocular adverse event. So in the group A, the patients let's say the doctor decides which dose and how often to give based on an ophthalmology evaluation. In the part 2, everybody had an ophthalmology evaluation, but also we had a VRA tool, as we call it, an anamnestic tool with questionnaire that the doctors could decide based on that questionnaire, and we wanted to see if there is concordance with the ophthalmology evaluation. So what we've seen is, again, we checked that the median PFS of all patients who received this dose of 1.9 milligram per kilogram at 18 months was 86%. So the combination is very efficacious, and we've seen that using the VRA tool, the doctors could manage the ocular adverse events very efficiently, and very rarely they had to use the ophthalmology examination, which I think is of extreme importance.